My name is Felicia Che, and this is a response video to discussion two, reviewing genetics. So, the scenario is a friend of mine um, performed a home genetics test, and it showed that she's predisposed to developing type 2 diabetes. And right now, she's just looking for a little support and a little education. So, as her friend and also as a nurse, I would let her know she's not alone and during this healthcare journey. And this is something that's very common amongst a lot of Americans and people all around the world. Um, First and foremost, I would make sure she understands just because she's predisposed to having the condition, it doesn't necessarily mean that she's going to develop that condition. She's just at a higher risk compared to the average population. I would also encourage her to go see a primary care provider and review and discuss her concerns with him or her because they're ultimately going to be the one monitoring her through this healthcare journey and also providing her with that support to ensure that it doesn't develop to full blown type 2 diabetes. I would also discuss with her lifestyle modifications is something that we can do to prevent the development of type 2 diabetes. Things like developing an exercise regimen, weight management, eating a healthier diet, fruits, vegetables, things like that, monitoring her carb intake. And during this discussion with her, when she divulged that she has this predisposition to developing type 2 diabetes, she also mentioned that she doesn't eat a lot of sugary foods. And this is a misconception among a lot of people. They think because I'm eating a lot of sugar, I'm going to develop type 2 diabetes, which having a lot of sugar is bad for you. It definitely helps to develop that condition, but I would educate her on the proper diet to prevent diabetes. And also, a big thing is the carb intake. A lot of people don't know that when we take in carbs, it actually breaks down to sugar, which in return causes our blood sugar to spike. So I would love to discuss with her importance of monitoring carb intake. Lots of fruits, lots of veggies are high in carbs, so that would be something she would need to keep an eye out on. Um, Proper exercise, creating a regimen, whether it's starting off doing cardio 30 minutes a day, resistance training, things like that. But ultimately, it would be to consult with her healthcare provider. Again, they're going to be the one monitoring her, managing her. They can also do labs because that diagnosis of type 2 diabetes is ultimately going to show through an A1C. But yeah, that would be probably the best advice outside of supporting her and being there with her is to talk to a physician. Make sure she understands being predisposed to having diabetes doesn't mean it's going to progress to that condition. And type 2 diabetes is absolutely preventable with lifestyle modifications.